Hi, my name is Lina.
And my name is Maria.
And the topic that we chose for our developmental issues project was anorexia in adolescents.
I hope you enjoy our presentation.
Anorexia is an eating disorder in which a person intentionally limits the intake of food because of a strong drive of thinness and an intense fear of gaining weight.
It is a chronic, life-threatening disease that can last for years or even for a lifetime.
Patients with anorexia have a distorted body image, therefore they make a deliberate effort to lose weight.
Anorexia typically begins during adolescence and early adulthood, and it is the third most common disease in adolescence. The exact cause of anorexia is unknown. There is a combination of biological, psychological, and environmental factors that can affect anorexia.
From the biological point of view, although it's not yet clear which genes are involved, there may be genetic changes that make people more vulnerable to developing anorexia.
From the psychological point of view, emotional characteristics may contribute to anorexia. For example, a person with OCD will be able to stick to a diet and forego food despite being hungry.
From the environmental point of view, in today's society, our culture emphasizes thinness. Peer pressure may encourage the desire to be skinny.
Behavioral and environmental symptoms include but are not limited to attempts to lose weight by severe fasting or dieting, excessive exercise, self-inducing vomiting, usage of laxatives, suicidal thoughts, and social withdrawal.
There are physical, environmental, and behavioral symptoms. Physical symptoms include but are not limited to extreme weight loss, abnormal blood count, fatigue, syncope, amenorrhea, low blood pressure, and arrhythmia. Statistics show that there are more than 200,000 cases per year in the United States.
Anorexia is more common in women than in men. Around 85 to 90% of patients affected by anorexia are women. Because anorexia is most common in women, being a female increases the risk of developing this eating disorder.
Adolescents are also at high risk mainly because of peer pressure. Changes in certain genes may make people more susceptible.
People with a family history of anorexia have a much higher risk of getting it. Changes in a person's weight and the positive and negative feedback they receive can trigger anorexia.
Change in lifestyle can bring emotional stress and increase the risk of anorexia.
Media and society always encourages skinny body image. Some of the complications of anorexia include but are not limited to bone loss,
Cardiac issues such as mitral valve prolapse and dysrhythmias,
kidney problems, anemia, suicide,
gastrointestinal problems such as constipation, bloating, and nausea.
There are several treatments for anorexia. Some of these treatments include hospitalization, which is needed in two cases. The first case is when the patient is severely underweight, and the second case is when the outpatient treatment was not successful.
You cannot recover from an eating disorder without restoring your appropriate weight. Psychologists and nutritionists will help the patient come up with a strategy to get back to the healthy weight. There isn't a medication that can cure anorexia. However, antidepressants can help treat other mental disorders such as anxiety and depression.
Therapy includes two types of therapies. The first therapy is the family-based therapy. In this therapy, family is involved and they have a big impact on the patient. With support, they can help cure the disorder.
The second type of therapy is the individual therapy. The main goal is to normalize eating patterns and behaviors to support weight gain. Another goal in this therapy is to reduce distorted thoughts that maintain the restrictive eating.
So this is the end of our presentation. We hope you guys enjoyed it. We had a lot of fun making it.
We are both hoping to apply this research into our careers.
Now stick around for some bloopers.
Bye!
Bye! Environmental. Okay.
Lena, stop.
One. Eye bags. 1, 2.
In an era where there's eye bags.
Oh my gosh. Okay, sing clip.
No.
The exact cause of anorexia is...
What happened?
Stop!